Hi everyone, my name is Allison Lucchese. I'm a licensed marriage and family therapist here at Embracing You Therapy. Today I wanted to talk about the link between OCD and addiction. Living with OCD can be challenging on its own, but when coupled with addiction, the road to recovery can become even more complex. Both OCD and addiction come with their own stigmas and misconceptions. People who struggle with both are often subjected to unhelpful and isolating commentary from family, friends, peers. The intersection of OCD and addiction creates a unique set of obstacles, forming a formidable duel that requires a comprehensive approach to treatment. For instance, individuals with OCD may turn to substances as a way to cope with the overwhelming anxiety and distress caused by obsessive thoughts and compulsive behaviors. On the flip side, addiction can exacerbate OCD symptoms, creating a vicious cycle that is difficult to break. The underlying connection lies in the brain's reward system, where compulsive behaviors and substance use both trigger the release of neurotransmitters like dopamine, providing temporary relief from distress. So, how do we go about treating OCD with addiction? For an individual struggling with both, seeking the expertise of a mental health professional who specializes in dual diagnosis is essential for creating an integrated treatment plan that encompasses evidence-based therapies for OCD, like ERP, along with addiction-focused interventions. When we look at OCD treatment and ERP, we see parallels between OCD behaviors and addiction actions. Much like the way OCD is a pattern of having an intrusive thought and acting on it to make the thought stop, addiction often has a series of having an urge or craving followed by substance use. So in both of these scenarios, there was likely a trigger. Learning how to be exposed to a trigger and respond with a more beneficial behavior is key. Whether we are talking about avoiding a ritual or walking away from a substance, learning how to identify negative thoughts and respond differently than you feel compelled to do is a really big part of OCD treatment. Because of the ways addiction and OCD interact, you may also feel overwhelmed by treating them both. It is sometimes helpful to focus on one or the other, despite knowing how they are interconnected. So if you are worried about the big picture, your anxiety may overtake your ability to manage your OCD. When you focus on keeping a handle on your obsessions and compulsions, you are more able to reduce the anxiety that can lead to addictive behaviors and vice versa. All of this, of course, brings me to the importance of support groups, peer networks, mindfulness, and coping skills. So for people struggling with OCD and addiction, we look at self-supporting behaviors like having a regular sleep schedule, eating enough food, drinking enough water, having outlets for stress such as like exercise, journaling, meditation, and even artistic expression. We seek to create a safe and stable environment where triggers are reduced or eliminated, and we have a plan in place for when triggers arise unexpectedly or they simply can't be avoided. Connecting with others who have walked a similar path fosters a supportive environment where individuals can share coping strategies, they can celebrate successes, they can offer encouragement during difficult times. Mindfulness techniques such as meditation, deep breathing exercises can also help individuals become more aware of their thoughts and impulses, allowing them to respond to them more effectively. Developing healthy coping skills such as stress management and problem solving empowers individuals to navigate the challenges that may contribute to the cycle of OCD and addiction. So, to start wrapping things up, I know this video mainly focused on OCD and addiction. There can be a variety of comorbidities when dealing with OCD, like depression, eating disorders, codependency. If you are interested in understanding your own OCD cycle and how to create changes in your life to manage it, I encourage you to reach out and gather more information. As always, if you have any additional questions, you can leave us a comment below or contact our office for a free consultation. You can also visit our website, embracingyouTherapy.com, for additional information. Hope you all have a great evening.